שלום חברים, הסרטון הבא הולך להשאיר אתכם בהלם טוטלי. תראו את הסרטון ונדבר אחר כך.
I do think that there needs to be sort of an honest broker, a centralized command and control organization that really brings together the public-private sector, both on a global approach and also on a local approach.
Thank you. Yes, I agree. And I wanted to speak to the point about having the honest broker. And I think in this regard, the United Nations fits the bill.
I think a complementary tactic, too, is to tap faith-based organizations and civil society and other institutions to recruit them also to basically, almost at a grassroots level, continue to basically have the integrity of the information.
It's important that the UN and WHO remain very clear, but when they challenge governments directly, they often get into this issue of sovereignty. And so I think it's really important not to have that as the only response. I think it's really critical to think about soft power influence.
As important background for this discussion, we want to start the meeting by viewing this news story that just aired on Global News Network.
Continuing our coverage of the newly discovered CAPS disease and the scope of its deadly outbreaks, there are now more than 30,000 reported cases. Experts warn this may be just the beginning of a global problem. GNN science reporters have produced a video about what we know so far about CAPS, the virus, the outbreak, and the resulting chaos.
CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years. Scientists think each infected person in turn infects on average 2 more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now. Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the air from person to person. Essentially, all people are susceptible. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere. Models developed by leading public health authorities indicate a CAPS pandemic could lead to an outcome worse than the 1918 influenza, which killed 50 to 100 million people worldwide. Given the global population is 4 times larger than it was in 1918, if these models prove accurate, we could be looking at hundreds of millions of deaths over the next year or 2. The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities, From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer.
The line between disinformation and misinformation is not always an easy one to find.
Governments need to be willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
It can happen quickly. A Marshall-type plan, don't mean to say that exactly, but a Marshall plan that can go into effect can stimulate a change very quickly.
The distrust relates to the health system more generally.
A step up from the part of the government on enforcement actions against fake news.
I think a couple of things we have to consider are, even before this began, the anti-vaccine movement was very strong, and this is something specifically.
אז מה אתם אומרים, חברים? ראיתם את הסרטון? אז איפה הפאנץ' ליין? הסרטון הזה צולם 6 שבועות לפני שהתחיל המקרה הראשון בסין, לפני שמישהו בכלל חשב על הקורונה. היה כנס שהשתתפו בו ראשים מכל המדינות, כולל ארגוני תרופות, כולל חברות תרופות, כולל ארגונים של בנקים בעולם. ומי מימן את הכנס הזה? מי אחד המפעילים של הכנס הזה? קרן מלינדה וביל גייטס, שני החברים שלנו. כנס רשמי, כמובן שהכל אני אתן לכם למטה בלינקים, תוכלו להיכנס ולבדוק בעיניים שלכם מתי הסרטון הזה צולם ובאיזה כנס זה היה. הכנס עצמו זה כנס של 5 שעות. הראיתי לכם קטע מתוך הכנס. עכשיו תבינו שמסתבר שבסוף 2019 גם היה תרגיל צבאי בווהאן, בסין. תרגיל צבאי, והוא פורסם ברשת הסינית. הרשת הסינית הורידה את הדף הזה מתוך האתר הרשמי שלהם, אבל יש חברה בארצות הברית שלוקדת דפי אינטרנט, ותפסה את הדף הזה מסוף 2019, שהם עשו בווהאן תרגיל על קורונה ווירוס. תגידו לי, משהו פה לא ממש מסריח?